Welcome to EnviroMed, where better medicine is truly better business. We're going to introduce you to our allergiCare program, where we treat allergies, not just symptoms. Have your patients ever said to you, "I'm sick and tired of being sick and tired all the time"? Have your patients tried to avoid allergies whenever and however they can, with limited success? You now have access to a program to help patients say goodbye to allergies forever. We call it allergiCare, the complete allergy diagnostic and therapy program specifically designed for primary care and urgent care markets. Let's take a look at a typical allergy patient and maybe some of the common complaints they might have. We'll start with fatigue, migraines, otitis media, conjunctivitis, rhinitis, postnasal drip, or strep throat. What about internal issues like gastroenteritis, celiac disease, vomiting, or diarrhea? Maybe even looking at upper respiratory issues like asthma, bronchitis, cough, sinusitis, laryngitis, wheezing, abnormal chest sounds, or upper respiratory infection. How about skin issues like dermatitis, hives, diaper rash, or eczema? Here's a question for you. How many times do you see this type of patient with these types of symptoms in your practice every single day? Wouldn't it be nice to eliminate these types of symptoms from an allergy patient's life for good? Of course it would. Now let's take a look at what a typical treatment therapy might be for your practice that you would give to somebody that had symptoms like the previous screen. You might prescribe an antihistamine. You might give a nasal decongestant. Maybe even prescribe a nasal steroid spray or give them a steroid shot. You might even forward them over to an allergy specialist. Or you might do all of the above. Are you really helping this patient at all? Here's a novel new idea. Why don't you treat allergies and stop treating symptoms? How do I do that, you ask? That's where we come in. The allergiCare program is a two-prong approach. First, we provide the allergy diagnostic piece, which is allergy test. The allergy test is a needle-free 72 antigen test kit used to identify what allergens are triggering allergy symptoms. We use the allergy test to provide avoidance measures to antigens your patients test positive to, as well as help determine the next course of therapy options, which is medication or immunotherapy. At its simplest form, we can confirm if a patient is allergic or not. And then we can observe how well allergy drops work by having a pre- and post-therapy test to compare. Second, we bring in the second part of this program, which is the therapy piece, allergy drops. Allergy drops are a comprehensive sublingual vaccine made of the top 100 allergens in North America. This vaccine is universal and multi-regional, which means the national immunity for allergy triggers. Sublingual immunotherapy is a well-recorded superior safety profile over allergy shots, which allows a broad patient range, meaning more patients can use allergy drops. The extra bonus is that allergy drops is less expensive, more convenient, and more effective than shots and medication. Here's an example of our allergy test. As you can see by the plastic applicator being held in my hand, it's needle-free. It's also safe to test. We only use environmental allergens in our mix. We do not use food allergens. It's also extremely easy to use and extremely easy to read, with results less than 15 minutes. As far as reimbursement for this test, the CPT code is 95004, and you have 70 units tested during each test. The ICD-9 codes have already been revealed to you by the symptoms we've already discussed. Using Medicaid reimbursement in Florida at $3.33 times 70 antigens is $233 per patient. When we look at Medicare at $7.77 times 70 antigens is $539 reimbursement. The average PPO reimbursement is over $5. So let's take a look at 5 times 70 is a minimum of $350 per patient. Now let's take a look at the allergies that ruin the picnic. You now have a solution to help patient lives normal lives. You now have an allergiCare program that you can promote in your lobby. So start treating allergies and stop treating just the symptoms. Provide better care, give better medicine, and improve a better business with EnviroMed's allergiCare program. EnviroMed, where better medicine is better business, and because we are all products of our own environment.